Hi everybody, my name is Allison and this is Primal Scream, a video log of the woman who is living her life one day at a time by the seat of her pants. Today we're going to talk about inflammation. So sit back and get ready to explore this topic fairly in depth. Hopefully it won't be too boring. But before we get started, don't forget to like this video, to subscribe to Primal Scream, and also to click on the little bell icon if you want to be notified whenever I post a new video. Okay, so first let's start with what is inflammation. So I have gone here to the National Institute of Environmental Health Sciences, which is part of the National Institute of Health, and just to look up what the definition is. So basically inflammation is anything that's inflamed, which sounds kind of nonsensical, but let's look a little more in depth. So I want you to look at the second paragraph. Inflammation is a normal part of the body's defense to injury or infection, and in this way it's beneficial. And when they're talking about that, they're talking about things like getting a splinter, getting a cut or a scrape. You might get inflamed, it might get a little warm, but that's really your body's immune system fighting off any infection or any foreign bodies that might be present in your body that way. But look at the second sentence. But inflammation is damaging when it occurs in healthy tissues or lasts too long. Known as chronic inflammation, it may persist for months or years, and that's what we're going to be talking about, is chronic inflammation. And I want you to look right here. Inflammation plays a key role in many diseases, some of which are becoming more common and severe. And chronic inflammatory diseases contribute to more than half of the deaths worldwide. And they list quite a few things here, but we're going to talk about some things like cardiovascular disease, diabetes, which is on the list as well. So that's where we're headed with this talk today. Okay, let's start with the first article I have brought up here, which is titled Obesity and Inflammation, the Linking Mechanism and the Complications. This was published in the Archive of Medical Sciences, which is peer-reviewed like all the articles, as I said in the introduction. So the main thing I want to look at, first of all, is the abstract. If you're not sure, if you've never seen how studies are published as articles, this is how they do it. It goes in a peer-reviewed journal. There's usually an abstract at the beginning, which gives a little summary of the whole study and gives pretty much most of the pertinent information for the average layperson. And then it has lots of other information. It goes in depth into all the background, all the research the researchers did prior to conducting the study. We're going to come back to this graph or this table in a few minutes. But then I want to show you at the bottom here, at the end of the article, here are all the citations, or it says references. They reference, for just this study alone, 137 other peer-reviewed journal articles. So that's how much information and research and background goes into each paper like this. So anyway, let's start with obesity and inflammation. So the abstract tells us what obesity is. It's the accumulation of abnormal or excessive fat that may interfere with the maintenance of an optimal state of health. The excess of macronutrients. Macronutrients are basically protein, carbs, and fat. So the presence of those in the adipose tissues, adipose is just another word for fat, stimulates them to release inflammatory mediators such as tumor necrosis factor alpha and interleukin-6. I want you to remember interleukin-6. We're going to look what that means in a minute. And reduces production of adiponectin, predisposing to a pro-inflammatory state and an oxidative stress. The increased level of interleukin-6 stimulates the liver to synthesize and secrete C-reactive protein. So I want you to remember that too, C-reactive protein. So let's talk about interleukin-6 and C-reactive protein real quick. So what is interleukin-6? Now this is not a peer-reviewed article, but this is News Medical Life Sciences, which is one of those honor code certified. See the little symbol right here on the bottom right? It means it's trustworthy information. It's been reviewed to be that. So this is Dr. Lee G. Thomas, who tells us that interleukin-6 or IL-6 is an endogenous chemical. That just means it's in something found in our bodies that is active in inflammation and B cell maturation. The big thing to note there is it's active in inflammation. So it says besides being an immune protein, IL-6 is also a pyrogen, which means it's responsible for fever and autoimmune infectious or non-infectious diseases. It's produced in the body wherever there is inflammation, either acute or chronic, and we're talking about chronic inflammation. This includes situations such as trauma, burns, cancers, and infection. Those are more of your acute ones. This chemical interacts with interleukin-6 receptor alpha to induce transcription of inflammatory gene products. So basically it means it's one of the things that causes inflammation. When it's released, then inflammation is found in our body, whether it's short-term or long-term. IL-6 is implicated in a host of chronic disease conditions associated with inflammation, and we're going to talk about that in just a moment. So that's what interleukin-6 is. What is C-reactive protein? So it is a blood test marker for inflammation in the body. And this is, what is this? This is Medicine.net, which is also an honor code certified, there's your honor code website, which means the information is trustworthy. Okay, so it is a blood test marker for inflammation in the body. It's produced in the liver and its level is measured by testing the blood. So it's classified as an acute phase reactant, which means that its levels will rise in response to inflammation. Okay, so both interleukin-6 or IL-6 and C-reactive protein are biomarkers, which just means things that are found in your body that indicate the presence of inflammation. So that's the most important thing to note. All right, back to obesity. As a risk factor, inflammation is an embedded mechanism of developed cardiovascular diseases, including coagulation, atherosclerosis, metabolic syndrome, insulin resistance, and diabetes mellitus. Also is associated with some other diseases, but we're more concerned about the biggies like cardiovascular disease and diabetes. On the other hand, a reduced level of adiponectin, a significant predictor of cardiovascular mortality, is associated with impaired fasting glucose leading to type 2 diabetes. That's all blah blah about the other issues. So the big conclusion, the big takeaway is managing obesity can help reduce the risks of cardiovascular diseases and poor outcome via inhibiting inflammatory mechanisms. So I want to show you real quick though, we were talking about how they certify or they reference other articles. Here's a table of many of the articles that they referenced for this study in this article. And all of these are studies. These are studies for cardiovascular disease. I want you to look at the biochemical IL-6, CRP. So that's interleukin-6 and C-reactive protein. Interleukin-6, C-reactive protein. So all of these cardiovascular diseases have an inflammation fact, or studies about cardiovascular diseases have a relation to inflammation. Look over here, you can see what kinds. Atherosclerosis and coagulation, so that basically is cholesterol in the blood. Cardiometabolic risks, metabolic syndrome. Metabolic syndrome is a precursor to diabetes, heart disease, etc. Coronary heart disease, cardiovascular disease, heart failure, etc. Insulin resistance, blood pressure, type 2 diabetes, myocardial infarction, which just is a fancy term for heart attack. So all of these have an inflammation-related aspect. So not only obesity, but cardiovascular disease as well as diabetes. Now, what do those three things have in common other than the fact that they are linked to inflammation in our chronic diseases? All of these are also related to high-risk groups with COVID-19, obesity, cardiovascular disease, and diabetes, type 2 diabetes. What is the other high-risk group? That is aging people, right? People who are over a certain age. So let's look at the relationship between inflammation and aging. This is called Inflammation and Aging, Cause, Effect, or Both, and it's from Discovery Medicine, another peer-reviewed journal. We're going to look at the abstract again. So it says, aging is a progressive degenerative process tightly integrated with inflammation. Cause and effect are not clear. A number of theories have been developed that attempt to define the role of chronic inflammation in aging. Redox stress, mitochondrial damage, that just means it's a type of cell damage, immunosenescence, endocrinosenescence, epigenetic modifications, and age-related diseases. Basically, these are all just immunosenescence and endocrinosenescence, things like that, all just mean things are going on inside your body. However, no single theory explains all aspects of aging. Instead, it is likely that multiple processes contribute and that all are intertwined with inflammatory responses. And I thought this piece was pretty interesting. Human immunodeficiency virus, or HIV, infected patients undergo a premature aging phenomenon which may provide clues to better elucidate the nature of inflammation and aging. Environmental and lifestyle effectors of inflammation may also contribute to modulation of both inflammation and age-related dysfunction. So again, inflammation is related to aging. They're not sure exactly what if it's cause, effect, or both, but there is a relationship. There is a correlation. Correlation is not causation, but there is a correlation. So having said that, they also spoke about lifestyle. We're going to talk a little bit about that towards the end of this. So your 4 big risk groups: cardiovascular disease, obesity, diabetes, type 2 diabetes, and aging, all have inflammation as a common theme. It's not the only thing, and may not be the cause necessarily, but having a chronic inflammation issue in your body seems to possibly predispose a person to either getting COVID or maybe having a more severe case of COVID. So again, I'm not an epidemiologist. I am not a doctor. I am simply a health educator who has been trained to look at the data and the information out there and to kind of put pieces together to come up with ways to prevent disease and to prevent injuries and things like that. So here's that. So we've talked about all of those things. Now we're going to look at specifically, since we talked about COVID-19 and the role of chronic inflammation in patients with obesity. This is the International Journal of Obesity in London. This is back from 2020, so it's a little bit old. It's about a year old. It's not old in the normal epidemiology world, but it is old in the coronavirus world because things change quickly. But it's still some good information. So let's see, coronavirus disease, or COVID-19, and the risk of severe acute respiratory syndrome, coronavirus 2, poses a particular risk to people living with pre-existing conditions that impair immune response or amplify pro-inflammatory response. So meaning for inflammatory. So again, they're relating that COVID-19 and being at risk for severe acute respiratory syndrome related to that virus poses a particular risk to people who live with pre-existing conditions that involve an amplified pro-inflammatory response. Low-grade chronic systemic inflammation, common in people with obesity, is associated with the development of atherosclerosis, type 2 diabetes, and hypertension, well-known comorbidities that adversely affect the outcomes of patients with COVID-19. So I'm going to go down, I'm going to skip sort of what they did, how they did it, and go down to the bottom. And it says, physicians should be aware of these findings in patients with COVID-19 infection. Early identification of possible hyperinflammation could be fundamental and should guide decision-making regarding hospitalization, early respiratory support, and therapy with immunosuppression to improve mortality. Now, I will tell you, my good friend Matt, who is a nurse practitioner, a PhD level nurse practitioner, who is a cardiovascular nurse practitioner, who does work with COVID patients in the hospitals here in Ocala, Florida, did let me know that they found that doing some of this inflammatory treatments, treating specifically for inflammation, is not necessarily as effective as they had hoped it would be. So I'm not coming at this, and as I explained to him, I'm not coming at this from a treating once you have the disease. I'm coming at this from a prevention aspect. So if we know that inflammation is linked with obesity, cardiovascular disease, diabetes, and aging, the 4 big risk groups for COVID, and we know that COVID is also linked to potentially severe outcomes in getting COVID, is linked also to inflammation, then maybe we should be looking at doing something about inflammation prior to potentially getting COVID-19. I'm going to look at another article here in the Clinical Trials Journal, which is the part of the European Journal of Nuclear Medicine and Molecular Imaging. And I'm just showing here that inflammation is seen in COVID-19 pneumonia in particular. What this study basically says is they did a specific type of PET scan. It's called a whole body FDG PET/CT. And it's just basically showing that they were able to see inflammation related to COVID, especially at the peak inflammation. It says inflammatory, the conclusion is inflammatory process at the presumed peak of the inflammatory phase in COVID-19 patients is obvious in these scans. And it talks about a specific glucose uptake issue that's heterogeneous and is typically focused on the lungs. So this is just a very specific, very, very narrow focused study looking at a specific way to measure lung involvement with the inflammation that comes along with COVID-19 pneumonia. So just to show you that there is a connection. And this article was from July 2020, so again, a little bit old. So we know the connection is there. We're just not sure from a treatment perspective, once you have COVID, how important that is. I'm coming at it from, is it important as a preventative effort on the front end before you get COVID? The next thing I'm going to look at is specifically an anti-inflammatory treatment of COVID-19 pneumonia with some specific medications that treat inflammation. Specifically, and I'm probably screwing this up, but it looks like it's called tofacitinib. Tofacitinib, I don't know how to say that, by itself or in combination with dexamethasone. So these are anti-inflammatory type medications. So the basic conclusion was that in combination, these two things were working to reduce inflammation. I don't know if they have that down here in the abstract or not. Yeah, they do. The inpatient treatment of COVID-19 pneumonia has rapidly evolved. The addition of dexamethasone has made a relevant improvement on survival. Other immunomodulators have yet to show an impact. So here they presented, this is jargon, this is medical jargon, not going to talk about that. They found that adding the tofacitinib-based anti-inflammatory therapy to a treatment regimen that already included dexamethasone in the COVID-19 pneumonia patients seems to have potential benefit of improving survival when compared with dexamethasone alone. And they had the percentages up here in the results. The proportions of death among those who got both medications was 10.1%, and those who only got the dexamethasone was 22.9%. They're saying this represents a 70% reduction in odds of dying among the group that got both medications. So that's a pretty good result. All right, so next we're going to look at a controversial medication, hydrochloroquine. And again, this is from August 2021. This is not a particularly old article. It's in the International Journal of Cardiology. It says hydrochloroquine reduces interleukin-6 levels after myocardial infarction. Remember, that is a heart attack. The randomized double-blind placebo-controlled oxypilot trial. So it's a pilot trial, which means it was the initial to see if we can make this study go. Once it has gone through pilot phase, if it was seen as successful, then they move it out to a more general, much larger test group. So myocardial infarction, if you remember, is heart attack. So, and all this stuff, randomized double-blind, just means that these are all protections to put in place to make sure there's no bias in the study. So again, this is just, they're looking at to determine the anti-inflammatory effect and safety of using hydroxychloroquine after acute myocardial infarction, so after a heart attack. The results. The levels of interleukin-6 were comparable at baseline between the study groups, so in other words, between the group that did not get the hydroxychloroquine and the group that did, so at baseline their levels were the same. At 6 months, the interleukin-6 levels were lower in the hydroxychloroquine group, and in the on-treatment analysis, the difference at this time point was even more pronounced. So as it went on, it got even more pronounced. And they also talk about high sensitivity, the C-reactive protein levels, that they did not differ significantly between the groups, but their interleukin-6 did. So this was a very small group. They did say 11 patients in the hydroxychloroquine group and 4 in the placebo group had adverse events leading to interruption or withdrawal of the study of medication, none of which was serious. Here's their conclusion. In patients with myocardial infarction or heart attack, hydroxychloroquine reduced interleukin-6 levels significantly more than did placebo without causing any clinically significant adverse events. So they're saying a larger randomized clinical trial is warranted to prove the potential ability of hydroxychloroquine to reduce cardiovascular endpoints after myocardial infarction. So they're saying for heart attack, it actually is reducing interleukin 6. Now, I'm not going to sit here and say that hydroxychloroquine is a miracle drug. I believe personally that it's been proven to work well in COVID patients in the early stages, without any significant adverse effects. However, it does not work well in somebody who's already been hospitalized, so you don't want to look at it for that. All right, so now let's talk about prevention, because that's really what I want to focus on. I just wanted to give you all that information because reducing inflammation in your body, not only is it healthy just in general, it is also potentially beneficial in helping you combat COVID-19 should you be so lucky as to contract it. So let's look at some of the things that we know they are prescribing and they're telling people to take at home, and actually you're using some in the hospitals as well if they happen to have COVID. What's the first one? Vitamin C, which is also known as ascorbic acid. So here's an article in the Many Reviews in Medicinal Chemistry, again peer-reviewed, that says that, of course, it was originally used for treating scurvy, but it says it's not just preferable to be at the bottom of the abstract. It's not just preferable to be used as an isolated mode of treatment, but can also be co-applied as an adjuvant to regulate immunity, gene expression, and other important physiological processes. So they also think that more studies should be done. But the biggest thing is it does have an effect, and it's not the whole article, it's just the abstract. It does have an effect on inflammation. It says right here, ascorbic acid is important in all stressful conditions that are linked to inflammatory processes and involve immunity. It has been known for decades that the persistence of an inflammatory stimulus is responsible for the onset of many diseases. Ascorbic acid is essential to stimulate the immune system by increasing the strength and protection of the organism. Therefore, its immunostimulant, anti-inflammatory, antiviral, and antibacterial roles are well known. We have summarized its main functions in different types of diseases related to immune system and chronic inflammation. So right here they're already saying, and they back it all up in the full article with all the references of how vitamin C works to mitigate inflammation, among other things. What's another one? Vitamin D, right? For immune system health. Vitamin D and inflammation. Potential implications for severity of COVID-19. This is in the Irish Medical Journal. Again, it's a little old, from May of 2020. But it has good information. So the hypothesis was that vitamin D status may influence the severity of responses to COVID-19, and that prevalence of vitamin D deficiency in Europe will be closely aligned to COVID-19 mortality. So let's go down to the conclusions. Let's see if I can find some good conclusions here. Hold on. So countries were selected by severity of infection and were limited to national surveys or were not available to geographic areas within the country affected by infection. COVID-19 infection and mortality data was gathered from the World Health Organization. The results counterintuitively, lower latitude and typically sunny countries such as Spain and Italy had low mean concentrations of vitamin D and high rates of vitamin D deficiency. These countries have also been experiencing the highest infection and death rates in Europe. What does that say? They have a high rate of vitamin D deficiency and they have the highest infection and death rates. The northern latitude countries, which receive less sunlight than southern Europe, actually had higher vitamin D concentrations and low levels for deficiency. And these particularly in the northern latitudes are Norway, Finland, and Sweden. For Norway and Finland, lower infection and death rates. So they are seeing potential correlation between vitamin D and reducing risk for COVID mortality. And they're relating it to the anti-inflammatory properties that vitamin D has. Zinc, that's another one we know they are using actively to treat COVID patients. Zinc status is associated with inflammation, oxidative stress, lipid, and glucose metabolism. Now this is really pretty old, January of 2018. So this has nothing to do with COVID in particular, but in general, it talks about how zinc plays a substantial role in development of metabolic syndrome, taking part in the regulation of cytokine expression, suppressing inflammation, and is also required to activate antioxidant enzymes. So the thing I want to look at here is that zinc suppresses inflammation. So they're saying deeper knowledge of zinc properties may help in treating metabolic syndrome. Remember we talked about metabolic syndrome being a precursor to diabetes type 2 and heart disease. So it says having a deeper knowledge of zinc's properties may help in treating metabolic syndrome, thus protecting against stroke, angina pectoris, which is chest pain generally due to heart, and ultimately against death. So the big takeaway from this is that zinc suppresses inflammation, and they're already connecting it here in 2018 to reducing risk of diabetes type 2, or the precursor for diabetes type 2 and heart disease. And this was published in the Journal of Physiological Sciences. So, granted, they're using some of these to treat, but you can also take these supplements as a preventative to focus on maybe trying to not make your body more susceptible to the virus and the severe effects of it. So, take it for what it's worth. Vitamin C, vitamin D, and zinc are all proven to have anti-inflammatory processes. And we know that obesity, heart disease, diabetes, aging, and even COVID-19 all have relation to inflammation in the body, chronic inflammation. So, but the best way, taking vitamins is a great way. It's a great way to supplement, but you really should also be looking at your diet. So this last article is not honor code. It's not a peer-reviewed journal article, but it is Harvard Health Publishing. So this is a Harvard Medical School online magazine. And this article from August of 2020, about a year ago, is on foods that fight inflammation. Doctors are learning that one of the best ways to reduce inflammation lies not in the medicine cabinet, but in the refrigerator. By following an anti-inflammatory diet, you can fight off inflammation for good. So it talks about here about, there are things that trigger inflammation in your body. So things that you eat and things that you don't eat that have to do with inflammation. So it says choosing the right anti-inflammatory foods, you may be able to reduce your risk of illness. Consistently pick the wrong ones and you can accelerate the inflammatory disease process. And right before that, Dr. Frank Hugh, a professor of nutrition and epidemiology in the Department of Nutrition at Harvard School of Public Health, says many experimental studies have shown that components of foods or beverages may have anti-inflammatory effects. So let's talk about what causes inflammation. I know I just kind of scrolled up to it for those of you who are looking at this visually, but what do you think those things are? Let's look at the very first one, refined carbohydrates, such as white bread and pastries. Yeah, I know, I like my bread and I like my pasta, but refined carbohydrates is on the very top of the list. And they're not saying don't eat it. I mean, it says try to avoid, but you can also just limit as much as the amount that you eat. Next one on the list, French fries and other fried foods, fried chicken, etc., things that we really like, right? Soda and other sugar-sweetened beverages. So for those of us Southerners who like our sweet tea from Publix, guess what? That's number 3 on the list. Red meat, such as burgers and steaks, and processed meat, like hot dogs and sausage. And then the last on the list, margarine, shortening, and lard. So basically all the things that are in our fast food restaurants, and in a lot of our, unfortunately, sit-down restaurants too, have these components: fried foods, refined carbohydrates. We drink soda or tea a lot of times, at least here in the South we do. Burgers and steaks, hot dogs, things that we eat a lot at fast food. Those are all things that put us at risk for inflammation. So some of these foods have been associated with increased risk for chronic diseases such as type 2 diabetes and heart disease, and are associated with excess inflammation, says Dr. Hugh. So what are good things to eat that are anti-inflammatory? So surprisingly, tomatoes. I know tomatoes are in the nightshade family, so a lot of people really don't like tomatoes being used as a good nutrition thing, but they really kind of can be. So anyway, tomatoes are on the list. Olive oil, which I cook almost exclusively with at home. Green leafy vegetables like spinach, kale, and collards. I would put on there like dark green romaine. Anything that has that darker green to it is going to be really, really good for anti-inflammation. Nuts like almonds and walnuts. So those of you, I love almonds. So I'm actually made a note on my grocery list to find some almonds that I can have at home, hopefully low sodium or no sodium, because the husband needs that, but that we can have as snacks. Fatty fish like salmon, mackerel, tuna, and sardines, and fruits such as strawberries, blueberries, cherries, and oranges. Now, if you've ever heard anything about the Mediterranean diet, these foods pretty much fall into that Mediterranean diet. And that is a diet that is often recommended by doctors and nutritionists and dietitians to combat heart disease and high cholesterol and diabetes and things like that. So just take that for what it's worth. So again, tomatoes, olive oil, green leafy vegetables, nuts, fatty fish, and fruit. And the benefits are, more than just the anti-inflammation. There's lots of other things they have. Studies of associated nuts with reduced markers of inflammation, lower risks. Coffee, which contains polyphenols and other anti-inflammatory compounds, may protect against inflammation as well. So if you're a coffee drinker, good for you. You actually may be helping your inflammation right there. So basically it says if you're really looking to reduce your levels of inflammation, you just need to aim for an overall healthy diet, which is what I was saying is very similar to the Mediterranean diet. It says it right here. Consider the Mediterranean diet. High in fruits, vegetables, nuts, whole grains, fish, and healthy oils. So there's a little poster on this website at thehealth.harvard.edu/staying-healthy/foods-that-fight-inflammation. You can see it right at the top of the screen here. And I will drop it in the comments as well. But the foods that fight inflammation, there's a nice little sort of poster thing you can print out that also shows what you should be avoiding down at the bottom. So again, I just wanted to come at this from a preventive perspective. I know this was kind of long and it might be a little bit boring, but I thought it was important to look at fighting inflammation and chronic inflammation in your body as a preventative against obesity, a preventative against heart disease, a preventative against diabetes type 2, a preventative against poor aging. I can give you just anecdotally, my own mother, whose age I will not give, because if I do, she will probably kill me if she ever sees this, but let's just say she is over the age of 80. She is extremely healthy, takes no prescription medications, and I can tell you that for the majority of her adult life, she ate as healthy as possible. Now, does she like her steak? Yes. She limits it. Does she like French fries occasionally? Yes. She does not drink soda. She does drink sweet tea, but she limits it, and she does not drink anything like that after a certain time of day so that her body has time to metabolize the carbohydrates before she goes to bed. She's not a huge sweet eater, so that's a good thing. Occasionally, particularly dark chocolate, which is a healthy thing. So I can just tell you that my mother, anecdotally, pretty much ate a very healthy diet that more or less corresponds to what Harvard has recommended here, and stays away from fast food and those sorts of things. And she's as healthy as a horse. So, take that for what it's worth, anecdotally. So again, I just wanted to come at this from a preventative perspective to make sure that my people out there have the knowledge they need to make good choices. It's still your choice, of course, but now you know. Inflammation is linked to all of these health issues and also linked to COVID-19. So it can't hurt to try to lower the chronic inflammation in your body by following what Harvard suggests, the Harvard Medical School magazine suggests, by eating certain foods and staying away from others. So again, I'm going to drop some of these links in the comments if you want to, especially the Harvard link, just so that you can go there yourself if you want to look at that information. And I hope that this was helpful information.
And there you have it. Sorry that was a little bit long. Like I said, I just wanted to make sure we covered everything and that you had the information you need, because ultimately it's your choice. But if you don't have the knowledge you need, how can you make good choices, right? So now you have the information. I am going to, like I said, I'm going to drop the links that I can into the comments below and actually in the description, sorry. And if you have any questions, please comment. Anytime you would like to ask a question or suggest a topic, please comment. I will see those comments and I will take everything very seriously. And if I can research a topic that I don't know much about, I'll be happy to do that. So back to inflammation real quick. So just keep in mind that these things, the inflammation is linked to so many chronic diseases. We've already talked about diabetes, heart disease, obesity is linked to inflammation as well. And also COVID-19. Now, I'm not going to sit here and tell you that trying to take care of inflammation with chronic inflammation within your body is going to keep you from getting COVID-19. It's not. I'm also not going to tell you that treating inflammation as part of treatment for COVID-19 is going to be the be-all, end-all, cure-all. It's not. I'm just saying that since inflammation is linked to all of these things, including COVID-19, we may be better off if we combat some of that chronic inflammation before we get sick with any of these chronic diseases, or before we get COVID-19, if we should be so unlucky as to get it from someone. So again, can't hurt. It's a healthy diet. It can't hurt. It's something that I'm going to start trying to do. I have not been real good at doing that, even though we are eating low sodium here in our household. I cannot say that we've really been adhering to anything that looks like the Mediterranean diet, but we are going to start trying to do that, as I do like to practice what I preach. So anyway, that's it on inflammation. Again, drop me any questions in the comments or any topics you might like to see. I'll have the information I can give you in the description of this video. So that's it on inflammation. But before we go, this is called Primal Scream, and we're going to do a Primal Scream for every video. So what are we going to Primal Scream about today? Maybe the fact that in order for us to be healthy, we have to eat healthy, and that's just sometimes not much fun. So let's do our Primal Scream together in 3, 2, 1. Ah! So there's mine. All right. Thank you so much for joining me. I hope to see you next time around.